Since the fall, you said.
Yeah, it's been about 4 months now.
Okay.
And it just comes and goes.
I assume you can see the largest letter here?
Yeah.
Okay. So we're slightly closer than 20 feet. I'm going to have you jump way down here. Can you read this line for me?
LEF. Yes. Yes. Yes.
And here.
Same. Same.
Does it feel the same?
Feels sharp. Sharp.
Dorsal side of the foot here.
Sharp.
Same there. And then your toes are just a little bit colder on this side. Can you feel that sharp there? Does that feel the same?
Yeah, it does.
Hi, Hannah.
Hello.
How's it going?
It's good.
Good. Feeling okay today?
Mostly, yeah.
Okay, well, it's nice to see you in the office again. It's been a little while since I've seen you. Your last annual visit was about a year ago, so you're right on time. Thank you for keeping up with your visits. Now, I didn't have anything specific in the notes today. It looks like you're just in for another kind of basic physical inspection.
Yeah, just here for my annual, pretty much.
Okay. Any new concerns? Anything that's changed since your last exam?
I've been getting a little bit more sinus pressure and these sort of mini colds, but
Okay.
other than that, not really.
Okay. Mini colds. How many times would you say you've been like sick in the last several months?
I kind of feel sick for like 2 days.
Okay.
And then it goes away. So it doesn't feel like a full-on cold.
Okay.
But I'll kind of have congestion and sniffles for a couple of days, like every once a month.
Okay, but doesn't quite develop into like a full cold symptom. All right.
But usually I don't get sick at all, so it's kind of...
Are those symptoms like specifically related to your sinuses? Do you feel like you end up having a
Yeah,
cough, a
I
fever?
get pressure here, I get a bit of a drippy nose,
Okay.
some sneezing, and just kind of like a little more fatigue than normal
Okay.
during that time.
It has been pretty chilly recently. Is this something that's been happening like new onset as the season has changed, or were you feeling this when the weather was a little bit warmer?
No, it's more since the fall.
Okay, all right. So I'll definitely have a look at your sinuses. I'll have a look inside your nose and see, if there's any inflammation or anything going on. With that, have you noticed any swelling like of the neck area or like thyroid, lymph nodes, no pain or tenderness or anything there?
No, I've had a little bit of like stomach discomfort with it. I wasn't
Okay.
sure if it was just because I was just feeling like less well overall.
Okay.
But just a little bit of cramping and feeling like a little uneasy.
Okay, interesting. So we'll definitely have a look at that. I can kind of palpate around and see if there's anything related. Sometimes if there's like an issue with your like GI tract or you're having some issues with like inflammation, it can kind of just coincide with everything and it just feels a little off altogether. So I will have a look at that as a whole. Any like increased head or eye pressure, pain behind the eyes, or like tenderness?
Pressure behind the eyes, yeah. And then a little bit of pressure in the abdomen as well.
Okay, so just kind of like a general unwell.
Yeah.
Okay.
It's just not feeling my best.
Okay.
But then it goes away. So.
Pain associated with that, or like just
Other than a little bit of cramping, no.
no? Okay, all right. Well, it's definitely something to note. Let's just take a note of that. So, since the fall, you said.
Yeah, it's been about 4 months now.
Okay.
And it just comes and goes.
Any changes to your diet or anything? Have you been eating anything differently, or eating more, eating less?
No, my diet's been relatively stable.
Increased exercise, maybe?
I've definitely increased my activity level.
Okay.
But like on the days I don't feel the best, I don't usually work out.
Make sure you're getting some rest in for sure.
Yeah.
Are you pretty good about staying hydrated? Your skin looks fairly well hydrated.
I think so, yeah.
Okay, good.
Water.
All right. Just a follow-up question. As far as like the stomach discomfort, any issues with your bowels? Have you been having like overactive bowels, underactive, any constipation?
I get a little constipated during those periods.
Okay. So just from the sounds of it, you know, not doing any physical inspection just yet, it sounds like it could be an issue with like maybe mucus production. Sometimes if you're having an increase of sinus production, it can also affect your GI tract, and then that mucus can kind of block you up a little bit. So definitely do some palpating around. Otherwise, I will just kind of do my basic physical inspection. So similar with last year, I kind of run head to toe. I'll ask you questions as we go along, see if there's anything I see that's, you know, particularly of concern.
Yep.
So I'm going to start with just like a basic inspection of your face to start. I want to see before I do any palpations if there's anything concerning, and then I will ask you a couple more kind of neurologically based questions. So just gonna have a look here. I'm looking for kind of any external signs of swelling. Is it okay if I just touch your head here?
Of course.
And then if I palpate anywhere that feels particularly tender or painful, obviously you can let me know. So looking directly kind of over the nasal passages, I maybe see very mild swelling externally, nothing that looks of particular concern there. And then just let me look at the neck. I don't see any like bulging or anything there either. Okay, all right, you can go ahead and open your eyes. So I will have a more in-depth look of that obviously, but let's start with a couple kind of more passive things before we move into the physical examination here. So I'm just going to make sure that we document this. All right, so kind of getting back to the basics here. Can I have you just tell me what your first name is?
Hannah.
Good. Hannah. All right. And can you tell me who I am in relation to you? How do you know me?
You're my physician.
Good. And why are you here today?
I'm here for my annual checkup, wellness checkup.
Very good. All right. Can you tell me what you had for dinner last night?
I had leftover Indian food.
Okay, good. Hopefully it was good.
It
Good.
was so good.
I love Indian food myself. All right. And how did you obtain that Indian food? Did you drive in a car, ride in a bus?
I walked.
Walked. Okay. Good. And can you tell me about what time of day it is right now? Morning, evening?
It's afternoon, probably around noon.
Good. So just checking a little bit of your, you know, relative short-term memory. I'd like you to tell me what color this room is. So just base color.
It's a light green.
Light green.
Yeah, it's a nice
Good.
color. I really like it.
Thank you. I picked it out myself. I quite like it. All right, so that is very good. And then just a couple questions about your long-term kind of memory here. If you can tell me, what was your favorite teacher's name in elementary school? Going way
Elementary
far
school?
back. Yep.
Mrs. Snap.
Good. Okay.
I wonder if she's still alive.
Oh, well, I hope so.
She was pretty old when I was a kid, so
And what did Mrs. Knapp teach you?
second grade.
All right. Very good. So testing a little bit of like your, you know, memory, if you're able to recall things normally, which it does seem like you are. So I'm going to verbalize 3 words to you. I'd like you to repeat them aloud, and then we're going to kind of follow back. So try to remember them if you can.
Okay.
So picture,
Picture,
plant,
plant,
potato.
potato.
Okay, so just remember those. Gonna write them down so there's no cheating. All right. I'm going to give you a couple very simple equations, just very elementary, nothing, you know, super strenuous. I'd like you to try to solve them for me, just kind of verbally. Okay?
Okay.
11 minus 7.
4,
Good. And 4 plus 5.
9,
And 9 minus 3.
6,
And what is 6 plus 4?
10.
Do you remember the first equation that I gave you? It's okay if you don't.
I know the answer was 4.
Very good. Okay.
11
Good enough.
minus 7.
11 minus 7. Good job. That one's a little tricky. You did very good. Do you remember those 3 words that I asked you about a minute ago?
Picture, potato,
Good.
and plants.
Very good. That is good. All right. All right. So give me just a second here. I am going to... Can you tell me what this shape is here?
It's a triangle.
Very good. And now, excuse my terrible drawing, but that is a shape.
It's a star.
Very good. Okay. Now I'm going to hand you the pen. I have another triangle here. I'd like you to circle around the triangle. And then if you could box in the circle. Very good. So just testing a little bit of your dexterity. You did very well with that. Okay. All right, Hannah, so we can go ahead and move on. I am going to finish up a bit of an upper body neurological exam here. I'm going to test something called graphesthesia, just a very big word for it. I'm going to draw some things in your hand, and I want you to just try to tell me what they are. So I'll have you close your eyes. And I'm going to start with capital letters.
T.
Good.
One more time, please. Which direction is
It could, could be the orientation. It is facing you, but I'll try one more time.
Okay. That's an E.
Good.
That's an N.
Good. And what does that spell?
10.
Good. Okay. So on the other hand, I'm going to do a couple of numbers and just recite them to me.
3.
Okay.
4.
Good. And one more.
7.
Yes. Okay. Very good. So that one's a little bit difficult. The orientation can be kind of tricky there, but you did a good job. So I'm going to have you close your eyes for me one more time. I'm going to hand you a series of objects, and I'd like you to attempt to identify them. It doesn't have to be super specific, just what you think it could be. So I'll have you start with that.
Pen.
Good. And here.
Cotton swab.
Good. And lastly.
Bottle.
Good. Okay. Very good. So ability to identify basic everyday objects is intact. All right, so we are going to move on to a bit of a test of your kind of visual acuity, orbital exam health. Any issues with your eyes besides you said you do feel like a little bit of pressure?
No.
Yeah. You don't wear glasses or anything?
I do not.
Okay. So I'm going to have you look at that point across the wall there. I'm going to do a bit of an ocular exam here, shine a light in your eyes. I will try not to blind you too much. So beautifully colored eyes.
Thank you.
So this tests a couple different things, just looking at the reactivity of your pupils, both individually and as a pair. They should accommodate each other fairly well. Any blurry vision as I come in with the light? Good. Okay. So I'm going to do what's called a follow the light test, which is just as it sounds. I'll have you keep your head straight for me, and I want you to follow with your eyes. Try not to move your head. And let me know again if you have any blurry vision here. We're going to come way, way in. Good. Any difficulty with that?
No.
Good. All right, so a very brief test of your visual acuity, which just going to have you look at this chart. I'm sure you're fairly familiar with it. I assume you can see the largest letter here.
Yeah.
Okay. So we're slightly closer than 20 feet. I'm going to have you jump way down here. Can you read this line for me?
LEFODPCT.
Perfect. I'll have you close one eye for me. You can choose. I'm going to have you read this line here.
FDPLTCE, the O.
Good. And if you can switch eyes for me, I'm going to have you read the bottom line.
PEZOLCFTD.
Good. Both eyes open. Can you tell me what color this is?
Blue.
And my top?
It is black.
Good. Okay. So no issues with your visual acuity. Now, obviously not an optometrist, but I do like to do a very brief test of your color deficiency. Now, didn't see any notes when we tested that you had any issues, with this last year. So, test some red and green. Do you see any numbers here?
Yeah. 29.
29, very good. And opposite orientation here.
5.
Good. And here.
15. 13.
Good. We will kind of jump back here. This one's a little bit harder.
40.
42. Very good. Okay. Now the last one, you're not going to see a number. You are going to see a pattern. I'd like you to trace it with your non-dominant hand for me. So you'll see an X, trace it to the other X. Very good. So just testing a couple different things. It also allows me to see how well you do with that opposite hand there. So that is very good. All right. So I'm going to test just basic temperature of your face here. I don't want to start touching you and then heat you up with the warmness of my hands. So I do like to start here behind the ear. Okay, so a little bit warm there, just at the lymph node site. So I will do some palpation. I just want to see if there's any signs of inflammation happening, especially since you said you were having some issues with your sinuses. All right, so let's see. Let me go ahead and jump back here. Okay, so I'm going to have a look inside your eyes just briefly. I want to see if there's any kind of cranial pressure happening. So I'm going to have you just kind of lazily open your eyes for me. I will be coming very, very close to your face. Okay, so reflex does look okay. I do see just a little bit of pinkening of the sclera, but nothing that I would say is kind of really of concern there. Do you have any tenderness at the tear duct here?
Yeah, just a little bit.
A little bit, okay. So just a little bit pinker than what I would say is normal. Not so much on this side. Optic disc is clear and visible though. Okay. And then same tenderness, or is it okay on this side?
It doesn't really hurt on that side.
Okay, all right. Okay. Do you ever have any issues with your ears or your hearing? Any like muffling or excess earwax, anything like that? Do you wear headphones, either internal or over the ear?
I do both.
Okay. So just watch out for sound. That's really the only thing that I recommend. I would say most people are probably listening to it at a louder decibel than they should be, so just something to be aware of. Might tickle just a bit. I'm going to come inside. Okay, ear canal is very clear. Very normal earwax. I'm not seeing any abnormal cerumen, nothing, no abnormal texture or anything there, so that's good. This side I see a little bit of external earwax there. Okay, that looks good though. All right. So I'm just gonna have a peek here actually while I have this out. If I could have you tilt your head back for me, I'm gonna peek at the nares. Okay. Then if I can have you just open and say, Good. If you could smile for me with your teeth and then stick your tongue out. Move it side to side. Very good. Okay. All right. So your nasal passages are clear. I did notice a little bit of pinkening, as with just kind of the sclera here. It's just a little bit pink. I do see why you're having the tenderness of the tear duct on this side. Do you feel like when you're having the issues with your sinuses, one side is worse than the other? Does it feel about the same?
Honestly, I haven't noticed. I'd have to pay more attention.
Okay, all right. So let's do a bit of an occlusion test here. So I'm going to have you just breathe in for me. fairly clear. And here? Sounds a little bit occluded to me there. Did you feel a difference at all?
Definitely.
You did. Okay. All right.
I feel like it jumps back and forth though.
Switches sides.
Yeah.
Are you taking anything for seasonal allergies, like Claritin or?
I was in the spring and the summer, but I don't
You haven't
traditionally
been?
get them in
Okay.
the fall.
Okay.
So that would be
Also
good.
not great to take it long term, so okay. All right, Hannah, so I'm gonna have you close your eyes for me. I've got a scented spray here. I'm gonna test a couple of different things. So firstly, I want you to try to tell me what this smells like.
Like a mix of like lavender and alcohol.
Good. Well, it's hand sanitizer, so that is a very good observation there. Now I'm going to occlude this side, and obviously you know what it smells like, but can you smell that there?
Yeah, it's not quite as strong.
Okay, and then if we do this side,
Yeah, I can smell
smell it more than the other side?
it. Mm-hmm.
Okay, so definitely just a little bit of blockage happening there. All right. Okay, we can go ahead and move on. Let me just... left side. Okay. Have you ever seen an otolaryngologist, an ENT specialist?
No, never.
Okay. Depending on the outcome of kind of abdominal palpation, I might suggest that we refer you out to someone. They can do a little bit more of an in-depth exam and see if there's something that, like if you have any nasal polyps that are inflamed or kind of what the root of the issue is. All right. So while I am up kind of in the facial region, I'm going to test a couple different things. All right, so I'm going to start with a basic sensory exam here. So I've got this cotton swab that we used earlier. Do you feel that that's fairly soft? Okay. I'm going to touch it to your face. I'd like you to let me know when you feel it, so you'll just say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Okay. I'm going to switch now to this other side. Can you feel that?
Mm-hmm.
Okay, so same thing, just say yes if you feel it.
Yes. 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 Yes.
Okay, good. Switching objects here, I have a very sharp Wartenberg wheel, kind of modified to cover a bigger surface area here. I'm going to touch this to your face now, just as a baseline. Do you feel this?
Mm-hmm.
Do you feel that it's sharp?
Mm-hmm.
And you feel on this side that it's sharp?
Mm-hmm.
So comparatively, does this sharpness feel about the same as that?
No.
No? Let's try that again. So this here. Does that
Yeah, that's the same.
feel the same? And here.
Same. Same.
And here.
Yeah, that's the same.
Any difference both as I come down the arm towards the wrist and then the arms comparatively, they feel the same? Good. Same idea here. Does this feel cold?
Mm-hmm.
Same coldness here?
Yes. Cold. Cold. Cold.
Any difference in coldness as I come down towards the fingers?
No. Same.
And then this feels about the same here.
Try that again. Yeah, same.
Good. Okay. All right. So you can open your eyes for this one. I'm going to test bone conduction. So you should feel vibration here.
A little bit. Yeah.
Kind of mild. Yeah. Feel that?
Mm-hmm.
There. Good. Tell me when it stops.
It's gone.
Okay. Feel vibration there.
Mm-hmm.
Tell me when it stops.
It's gone.
Feel it here and here. harder on the elbow. Do you feel that there?
Yes.
Good. And I'm just going to test.
Yeah.
Good. Does that feel the same from side to side? Any like less on one side or the other?
No, I feel the same.
Okay. All right. So I'm going to have you look just straight ahead for me. I want you to completely ignore what I'm doing. I'm going to fiddle around in your hand a little bit. Good. All right. Very good. So we are going to continue moving along here. Do you have any questions for me so far, Hannah?
Yeah.
So I'm going to test your corneal reflex, and I am afraid I'm going to irritate this side a little bit, so I'm not going to do it too much, but I'm going to start with a Q-tip. I want you to look straight ahead for me. You can allow yourself to blink when you need to. So bringing this closer to your eye. Sensitivity here. Does it feel any more sensitive on this side?
A little bit. Yeah.
Okay. All right, so I'm going to palpate around now. Are you having any current tenderness anywhere of the scalp? Anything behind the ears? Everything feels okay?
I think so.
Okay. So when I start palpating, if you do feel anything, feel free to let me know. So I'm just going to kind of hold you stable here. So I'm feeling for a couple of different things here, Hannah. One, I like to feel for smoothness of the cranium itself, so feeling for any lumps or bumps. You can sometimes feel some abnormalities near the base of the skull, which is so far not notable. And then if I come up more towards the crown, and if I palpate my laterally here, that feels okay. Do you feel any pressure here?
A little bit on the right side.
A little bit on the right side, okay. How about back here behind the ear?
No, that's fine.
Just gonna have a quick peek here, see if there's anything in the scalp that you could be feeling tender to, but all of that does look okay. All right, okay. So I'm gonna do some facial palpations now. You can just either eyes open or closed, whatever is more comfortable. Definitely feel a little bit of,
Yeah, it feels more tender,
Yeah.
like over my eyebrow on the right side and underneath there.
definitely feel a little bit of pressure build up here, especially right here.
Mm-hmm.
I'm gonna hold here and have you open your mouth and then close. Does that increase or decrease the pain at all? Just about the same. Good. And I'll have you do that one more time. Go ahead and open and close. Okay. So just making sure that's not related to any inflammation of the jaw. So I'm gonna come kind of behind you here and palpate out the jawline. Feeling any swelling of the lymph nodes, at least nothing notable, there's nothing palpable. I'm gonna have you swallow for me. Okay. Just gonna feel along the clavicle, you've got some lymph nodes here as well. Okay. Any tenderness of the upper extremities, the shoulder sore at all?
A little like muscularly sore, but not in a bad way.
Okay. All right. Okay. So overall, I do note a little bit of inflammation for sure, specifically on the right side, maybe mildly on the left, but not as severe. So just kind of something to keep in mind there. You have beautiful hair, nice and full, very healthy. All right. So I'm going to have a peek at the upper extremities here. Good. Skin is very clear, nice and warm, well moisturized. I don't see any very prominent veins, which is good. Brief test here of your capillary refill. Does look okay. Hands are very warm as a whole, so that's a good sign. All right. Before we move down to kind of lower body, I'm going to test some strength of your arms. So I'm going to have you start by holding your arms up like this. I'm going to pull towards me. Try not to let me do that. Very strong. And push. Very good. I might be a little weak. Good job. So we're going to test just the wrist now. I'll have you hold up like this. Don't let me kind of pull forward and then try to pull down. Very good. If we can do just fingers. Good. And then I want you to grip really, really tight. And then if you can do thumb and pinky. Let's do that one more time. Okay. Are you left or right-handed?
I'm right-handed.
Okay. Maybe just a little tinge weak on that right side there, but that was okay. All right, so that looks okay. I will go ahead and do your lower extremity, and then I'm going to palpate around your belly just a little bit, and then we'll kind of come back up. Okay? So moving down into the lower extremity examination, any concerns or questions about your legs? Have you had any kind of weakness in the lower extremities, anything like that? I know you're pretty active in general, so I'm going to have just kind of an overall look here. Don't expect to find anything, to be honest with you, but I love your socks, very cute. Looks okay. So I mostly look at like the bony prominences, so just looking for any like lumping of the knees, anything that looks awry with the legs, but you are fairly well aligned. Muscle tone looks good there, and your legs are nice and warm. My hands are a little cold. So I'm going to start by doing the same sensory test on your legs, and then we will move into some strength just like we did on your arms. So I'll have you close your eyes and really testing for symmetry here. I don't doubt that you can feel it. I want you to tell me if it feels any different here. So is that there? Feel about the same as that? And if we come down,
Same.
Same, and then kind of lower calf about the same.
Yeah.
And if I go all the way down, is that identical to the other side?
Pretty much, yeah.
Same with the sharp. Is this
Yeah, sure.
feel pretty good there? I know you've got socks on, but kind of down at the foot. It's about the same. Your right foot is actually a little bit colder. Okay. So I'm going to do the very, very sharp here. So you should feel this. Same thing. Does it feel the same?
Feels sharp.
Dorsal side of the foot here. Same there. And then your toes are just a little bit colder on this side. Can you feel that sharp there? Does that feel the same?
Yeah, it does.
Okay. So this one might be a little bit harder. I'm going to do a puff of air. I don't want you to pay attention to the sound because I am going to try to trick you a little bit. So just tell me if you can feel it.
Yes, I felt that. Felt it. Felt it. A little lighter, but I still felt a little. Felt that. Felt that. Felt that. Yes. Yes. Yes.
Good. Okay. All right. So you can feel everything. I'm going to do just a quick Babinski here. This part is a little ticklish. I'm going to hold your foot actually. So just rest the whole weight of your foot for me. And I'm going to trace this up the bottom of your foot. So close your eyes for me. You're going to be able to feel it regardless. It's just a little easier for you to concentrate with your eyes closed. Delayed there.
Actually not really sensitive.
It's okay. Do you find that you're ticklish at all?
No.
Okay, so a little bit of a delayed reaction there, but that's okay. All right, Hannah, so we are going to do your lower extremity strength. I'm going to have you move around a little bit, just like we did with your arms. So I'm going to start by having you push up with your thigh if you can. So up here, good, in here. And then we'll do opposite, so I'll have you go down, very strong, down, and then up at the calf, and down, good, and up, and down. And then I'm going to have you push down with your feet, and up. And then spread your toes if you can. Good. And then pull them real tight together. Good. And then I'm going to have you rotate your ankles internally. So good. That side. Same time. Again, just a little bit. On the right side. And then out for me. Very good there. Okay. All right. And then if I can have you bring your leg up for me. So let's bend at the knee. I'm going to have you push up with the side.
Oh, like
Not
this.
very rigid there. Yeah, that's fine. And then let's do this side as well. So I'm testing two different things here and then good. Okay. Go ahead and relax your legs for me. All of that is fine. Did you feel any difference from one side or the other? Did it feel about the same? Okay. All right. I'm going to test through your sock and see if we get a reading here. Yeah, this side is quite a bit colder. Could just be that it's chilly outside and it's not that big of a deal, but I do feel quite a big difference there. You ever have issues with circulation at all?
I do get like some tinglings and coolness in my feet.
Both sides?
Both sides, yeah. Just especially in the winter.
See, I'm not getting a reading here at all, which just means it's too low for the thermometer to even read it, but we do get something on this side, so that's okay. All right, so I'm just going to take a quick note of that. It's not a big deal. I just always like to keep track just in case. This right side, lower extremity. All right, and then just lastly, before we move on to your just kind of brief abdominal check, I'm going to test for, just make sure you don't have any like peripheral neuropathy or anything. I'm just going to pull this down to your ankle if that's okay. You don't have to close your eyes. I'm going to sweep this kind of just very, very softly across your leg. I want you to tell me if it like burns at all, if you feel any burning sensation. No. Good. Okay. So sometimes with that tingling, if you feel like a very light brush of the skin, it can cause like a burning tingling, and I'm not finding that here, so that's okay. All right. Okay. So we can just have a look at your belly. Any areas that are particularly tender?
No, just I'm not in a flare-up right now, so
Okay,
it feels
good.
fine.
Okay. Thank you. I can set that aside for you. I'll actually just switch here and cover your legs so you're not freezing.
Thank you.
All right, so just doing a brief visual inspection here. I don't see any distension on one side or the other. Normal symmetry, concave of the rib cage, which is good. Any pain or tenderness of the bony prominence here?
No.
Just percussion of the chest wall and then down at the sternum there. Good. Good. Okay. Let's do a shallow palpation here to start with. Surface level palpation just checks for any signs of inflammation, if I feel any lumps or anything, and then I'm going to move into a deeper palpation, and that allows me to feel around for the organs. So if you feel any pain here, definitely let me know. Just going to check any pain at the kidneys. Good. Might not be able to feel, but do you feel vibration there at the
A little bit.
hip bone? This side?
A little bit.
Okay. All right, so that all looks okay. I don't see anything particularly wrong. Percussion all sounds normal. There's no areas that sound hollow or... Did you eat breakfast this morning?
I did, yeah.
Okay. All right, and then just want to make sure. So you can feel a sensation here. It feels sharper than it would be with just my hand.
Yeah.
Yeah, good. Okay, all right. All that is okay. I'll go ahead and give you your sweater. You can put that on. And then I don't see anything wrong today. I'm not noticing any abnormalities. There's nothing, you know, aside from the swelling. So I do see some swelling of the sinuses. There's a little bit of inflammation, right side more so than the left. I tend to get my left side more than my right. So just as far as that, it's kind of normal. Everybody's body is a little bit different. Only thing I would recommend for follow-up really is that I think seeing an ENT would be beneficial because they can kind of have a little bit of a more in-depth look. They'll probably like to test your sense of smell a couple different ways. Mostly looking for things like nasal polyps, any signs of inflammation internally. Do you still have your tonsils?
I do. Yeah.
You do, okay. Tonsils are intact. Do you feel like you ever have any issues? Do you get like strep throat, tonsillitis? No. Okay. And then I didn't see any inflammation of the ears or anything. Right side tear duct was a little bit tender though. Okay. So I would say it's entirely up to you. It's not something that I think, you know, is mandatory, like emergent, that you really need to go. I do think it could be beneficial since this is a problem that you've had kind of persisting for the last few months. So I can get you in. We've got in-house referrals. I have an ENT that I work with pretty frequently. So if you're comfortable with that, I can send you over the referral to your patient portal, and then you can kind of log in and make that appointment at whenever you're available.
Sounds great. Thank you.
Okay. All right. Well, aside from that, did you have any questions about your examination today?
No.
Okay. Well, thank you very much. It's always lovely to see you.
Thank you.
Please come back in for your next annual visit.